symptoms. Particularly some of the newer genomic studies have been able to differentiate between patients who most neatly fit the CFS criteria versus patients who most neatly fit the fibromyalgia criteria, knowing there is some overlap because of the symptoms involved. But at the clinical level, when you walk into a doctor's office, you may get one label or the other with the very same set of symptoms depending on what that individual practitioner knows and understands about the two labels. So oftentimes I think in the real world they're used quite interchangeably, but at a research level there are some important differences showing up. And I think this move toward subtyping is going to be important in terms of distinguishing those patient groups. And the same thing is true of irritable bowel syndrome and TMJ disorder and some of the other overlapping conditions that that frequently coexist with one another. I think many of the studies have shown that over time you not just have CFS to deal with, but you may have a whole host of things, including things like high blood pressure and diabetes and other things that are likely to occur over time as all of us age and become sort of subject to this. And we're up to 200 questions almost now, so we'll have our hands full for communicating with all of you after this through both the Chronicle and the CFS link. And I hope that if you're not already registered, then you will make yourselves aware of our progress as we continue on by becoming a member of the association, by contributing to the research campaign. And I believe if you click on the hyperlink at the bottom of the screen, it will take you to our website and in particular information about the research campaign. And we do have the ability and we'll be grateful to accept donations that are made both online, by mail and by telephone. And we certainly recognize that for many of you, a donation of any size is sacrificial, and that you have to give up health care or food or other things to be able to support the association, and we are ever grateful for gifts of any size. I think we will. Okay. Fortunately, many of the later questions are thank yous, so that's a good sign. We like that very much.
We'll go through these and maybe kind of I'll try to group them by topic and get some responses out over the next week or so. How's that sound?
Yeah, we're not in a position to answer individual questions personally, and some of them were about medication levels and individual symptoms and how to approach your physicians about the information either you've learned today or that's in the literature. And I guess the best advice there is just to be as strong an advocate, whether it's in your doctor's office or in front of Congress or whomever, be informed and be knowledgeable and be willing to engage in some give and take, particularly in the healthcare system. You are likely to know much more about this illness than any practitioner you see, given the very limited number of experts on CFS who are out there in medical practice. And we will continue to make available through the Chronicle and through the link articles from experts about topics that may be of interest to your own healthcare practitioners. And ultimately what we're working for is something I kind of keep in the back of my mind as a hometown diagnosis of not having to get in an airplane or travel 600 miles by car to see quote-unquote the CFS expert, but to be able to walk into your local internal medicine practice or family practitioner and say, I'm having these symptoms, and you can quickly and easily get a diagnosis and at least an approach to some symptomatic care and treatment. That's what we're working for. And I think with that, an hour and 25 minutes in, we will wrap it up and thank all of you for your participation this afternoon. We've got still 156 people online and 212 questions now.
I think
it represents just a huge amount of engagement in this topic, and it's exciting.
And I have to be honest with you guys that this is our third webinar, and it was actually a little bit easier. It's still not the easiest thing to do, but it was easier, and it makes me excited to do this on a regular basis, and also try to find some other individuals who will work with us in giving these types of webinars, these sessions, which are just great in order to be able to reach such a wide, geographically distinct, dispersed audience all in one fell swoop. So thank you very much for participating. We'll try to get back to you on some of the questions that have been raised, and
thanks for your
again.
ongoing support and your future support of this research initiative and other programs of the CFS Association of America. Take care and have a good rest of your day. Thanks very much.
Thank you.